Welcome to the 112th Healthcare Workers and Integrative Professionals Group. Our theme today is At Work, Healthy Boundaries and Self-Care. Today, I wanted to share an image that we have been using as our well-being framework, just to frame the meditation for us today. And what we have learned in these 112 sessions or 111 sessions up till today is that our well-being as healthcare providers, for us, those who have participated in the group, for us, it is emerging from three main legs on the stool, three main foundations. Emotional health, and we'll be focusing on boundaries at work today, one aspect of emotional health. Mindset and having healthy emotional boundaries and being healthy emotionally as a provider is essential to have an open, informed, healthy mindset. And community. Community is an essential leg of the stool for our well-being. It means that we're in connection. It means that we have a peer group. It means that we have a sense of belonging, a sense of peer communication, and a place to go, whether or not that's particular people or actually a group, to be able to connect, ground, heal, and to continue to serve from a place of our cup is full. Inside this triangle for the provider well-being framework is what are the formal practices and the informal moment-to-moment practices that help us to have the mindset, the sense of community and experience of community, and the emotional health so that we can continue in a healthy way. One of those formal practices is once a month we gather for our meditation. So I'd like to guide that now. And if you would like to share this meditation with others or share the newsletter follow-up, we'd like to include as many healthcare workers and integrative professionals in the community as possible, local and abroad, and also have this as a practice to be revisited. Something short, something that helps to ground in an exploration of personal boundaries at work for our health. This is introspective. You don't have to close your eyes, but you can. Finding your feet on the floor, beginning to allow your breathing, and taking a few moments to center your head over your spine for this opening meditation for our monthly group today. Pausing for a moment just to see where you are physically in your environment, and then also just to begin to check in and turn your attention inward if it helps you to lower your gaze or close your eyes. We'll be exploring boundaries. Starting with where you are today, noticing if you're breathing or holding your breath. Noticing to what extent you are arriving in this moment, or perhaps arrived, or in the process of coming into your body, into your own presence, into an awareness of what is happening in and around you, as opposed to being in your head. Sensing your environment, sensing your body, and sensing the internal and external, just for a moment to check in and see what's there. How am I doing? And as you continue to do that and check in with how you are in this moment, inviting all of your attention, all of your focus in a gentle but intentional way, so that you don't need to worry about what's happening next. You don't need to know what happens later this afternoon, or perhaps something that's on your mind. Just bringing your attention into this question. How am I? What am I noticing? Now. And the first thing to be aware of as you ask that question and continue to answer it is there a friendliness? Is there a welcoming tone? Is there a tenderness and a softness in how you're asking? And seeing if you can bring in a gentle inquiry, not a demand to know, not a pushiness, but just like a friend would ask you, how are you doing? How are you? And then as you continue to sit and center and arrive, asking yourself, how am I doing at work? In my work, as I work. And seeing if you can stay centered and stay breathing. And some of you may be seeing clients, some of you are in the process of creating your practice. Some of you are transitioning your practice from a purely conventional to an integrative practice. There can be lots involved with that, including seeing patients. Just see what bubbles up as you reflect and stay in your body, stay in the moment, stay with yourself. How am I doing at work? Continuing to let experiences or images or thoughts come in. See if you can stay present. That's an intentionally open-ended question, and the answer can be okay. And let's ask a close-ended question. Is there a boundary that I could identify for myself at work that would help me to be healthier? Is there a boundary that I could help, that I could identify that could help me be healthier at work? And as you ask that close-ended question, which is a yes/no question, or maybe there's specifics, thinking about something that you would set as a boundary for yourself, how you respond, something you do for yourself, something you remember. And let's just sit there for a few moments with the question. Examples can be how much time you spend on certain things, spending more time on something, spending less time on something. A boundary in a relationship, perhaps stating a need, or perhaps managing yourself in a relationship. Something that you'll do or you'll commit to, a boundary for yourself, for example, when or how you discuss things. These are examples of boundaries with time, boundaries with ourselves. Sitting in silence for a few minutes. If you notice that anything is becoming too mental or too stressful, placing a hand on your heart and a hand on your belly. And let's just reflect for a moment or two about one boundary that you could name that would help you be healthier at work. Not more than one, nothing too complicated. One boundary. It can almost be a request or commitment It's something where you're making a line, making a decision of some kind. And begin to wiggle your toes and move your fingers. I'm going to invite everyone to stretch their arms out to the side and even overhead and see whether or not you naturally yawn when you lift your hands overhead. We used to do meditation in the clinic every morning with the providers and the admin staff, and when we raised our hands, everybody would yawn. And yawning is a great transition to the parasympathetic nervous system, the rest, digest, learn, and sleep nervous system, where we are receptive and we take in and we notice and we integrate, as opposed to fight and flight and freeze. When we push and we react, we stay in autopilot, stop breathing so much, and really put energy to the emergency centers of our brain and body, as opposed to the learning integration centers. Thank you so much for joining today. And if you ever are noticing tension or stress at work and you're not sure why, this is a great meditation to use. And perhaps you do know why, and you'd like to give yourself a chance to further see what you can do and what step you can take, something you have control over to help yourself. Thanks for listening and for revisiting as needed.